Good day everyone, my name is Angel Arlibres and I'm from BSN 212C and I'm going to perform Leopold's maneuver return demonstration. Leopold's maneuver is a way of systematically palpating the abdomen, which is a non-invasive method in order for us to determine the fetal position, presentation, and the engagement of the baby inside the woman's uterus. So Leopold's maneuver is done at 36 weeks of gestation in order for the healthcare worker to be prepared for the women in labor. It is also a way to determine if it is safe to perform C-section or cesarean section over the over the patient or the pregnant woman. Now the next thing we need to do is to, before we start the whole procedure, we should first prepare the equipments needed such as the pillow, the towel, and the stethoscope that we'll be using in this procedure. The next thing we need to do is to perform hand washing in order to prevent infection and cross-contamination. The next thing we're going to do is to introduce ourselves to our patient and explain the procedure for us to gain her cooperation and for her to be informed about the procedure that we'll be doing to her. So, ma'am, good day. My name is Angel Arlibres. I'm your student nurse for today. So, kindly state your full name, ma'am. Okay, and your birthday, please. Okay, ma'am. So, how would you like me to call you, ma'am? Okay. So, Ma'am Camille, what language do you prefer speaking? Oh, you speak Tagalog and English. Okay. So, ma'am, I'm here because I'm going to perform Leopold's maneuver to you. Leopold's maneuver is a systematic palpation of the abdomen in order for us to determine your baby's position, presentation, and her or his engagement over your uterus. And what I'm going to do is to palpate your abdomen, and I'm going to amount the gentle pressure or firm pressure as I touch your abdomen in order for us to determine your baby's position. Would that be okay to you, ma'am? Okay, so before we start the whole procedure, I would like to encourage you to urinate first. For you to be comfortable as you do the whole procedure, ma'am. Okay, we should first encourage the patient to urinate in order for her to be comfortable and relax as she do the whole procedure. Also you should take note that a distended bladder may deviate the uterus. Okay, after the patient came back from urinating, you should assist the patient to position herself in a supine position. So, ma'am, lie down na po, and I will put a pillow in your head po, mama. Put a pillow on her head, beneath her head. Okay, ma'am. Then, assist the patient. Ask her to slightly flex the knee. Ma'am, kindly flex the knee a little bit. Okay. Okay, slightly flex the knee on the other side. Okay. So we did this in order to facilitate an accurate assessment and to provide comfort to our patient. Also, the flex knee would relieve the tension on her abdominal musculature. Now, what we're going to do is to get the towel, roll it like this, and insert it beneath the patient's hips. So, ask also the patient to, ma'am, kindly roll to the side so I can insert the towel beneath you. Okay, you do this in order to shift the uterus away from the blood vessel and prevent supine hypotensive syndrome. The next thing we're going to do is to rub our hands to make sure that they are warm. Also, we should take note that if we are right-handed, we should stand at the right side of the patient in order for us to easily grip the symphysis pubis as we do the third maneuver. Okay, After that, we ask the patient to, ma'am, I will expose your abdomen po. Is that okay to you, ma'am? Okay, so I will expose your abdomen na po, ma'am, ha? Okay, expose the abdomen of the patient like this. Okay. And apply warmth on our hand by rubbing it. And now we do the first maneuver or the fundal grip. And what we're going to do is to palpate the uterine fundus. So, like you shape a triangle like this and palpate the upper portion of the abdomen or the fundus using our palm. And you do this in order to determine the fetal lie, whether it is the fetal back, the fetal head, or the fetal breech, or the buttocks of the fetus. You can feel that it is the fetal head if it is round and hard, and it is movable. And you can feel if it is the fetal breech or the buttocks if it's soft and nodular. Okay. Okay, we just finished the first maneuver. We should then proceed to the second maneuver, which is the umbilical grip. And what we're going to do is to palpate downwards to determine the fetal back, the fetal extremities, and the anterior shoulders of our fetus. It is essential since we're going to auscultate the fetal heart rate and the fetal back. So what we're going to do is to steady the hand on one side and palpate it downward using your palm. So like this. Okay, like that. And determine the fetal back and fetal extremities. You will feel the fetal back if it's like a long hard structure, and you will feel the extremities if it is nodular. Okay, now we're done palpating this side. Now we're going to palpate the other side. Now we put our hands here on steady and palpate it downward. Okay. Alright. Now the next thing we're going to do is the third maneuver or the Pollock's grip. What we're going to do is to shape our hand in L and put it in the patient's symphysis pubis like this. It is done in order to determine the presenting part, and in order to determine if engagement has occurred. Okay. If it is movable, then it is not yet engaged. But if it's not movable anymore, then it is engaged. Okay, it's not movable anymore. Okay. Now we're going to do the fourth maneuver, which is the pelvic grip. And now, since we face the patient on the towards the patient earlier, we're going to face the feet of the patient. Then we palpate it onto the pubis. So like this. We do this in order to confirm the assessment of the third maneuver, and also to determine the flexion of the vertex. Okay, it is also to palpate for the prominence or the cephalic prominence. If the prominence is at the same side of the extremities, then it is flexed. But if it is if it is not faced on the extremities, then it is extended. All right. Okay, if you're done palpating for the fourth maneuver, you should cover the patient's abdomen in order for her not to be cold. Then you should inform the next thing we're going to do is to, while we take out our stethoscope, pull down slightly pull up slightly the shirt, and then pull down the blanket. And since on the second maneuver you have determined the fetal back, what you're going to do is to auscultate for the fetal heart tone. And you should take note that the normal fetal heart rate is 120 to 160 beats per minute. So, palpate first for the fetal back again. Okay, so the fetal back is here. Alright. Mom, I'm going to close your shirt. Okay. After you auscultate for the fetal heart tone, for the fetal heart rate, you should inform the patient of your assessment. So, ma'am, the baby is on the right side. It is in cephalic position, and your baby is already engaged. So, I have also auscultated. Also listen to your baby's fetal heart tone, and it is 123 beats per minute. Okay, ma'am. So before I leave the room, do you have any questions before I leave the room? All right. Okay, so before I leave, ma'am, let me make sure that you are comfortable. Ma'am, how was the assessment? Do you feel cold? Okay, ma'am, that's good to hear. So, if you have any questions, ma'am, don't hesitate to ask us, and we're always there to attend your concerns. Okay, ma'am. So I will be leaving, and I will be the next nurse will be attending to you soon. Okay, ma'am. Thank you so much. Have a great day po. Now, as we leave the room, you should document the data that you have gathered along with the position of the baby, the presentation of the baby, if the fetus is already engaged, and also the fetal heart rate that you have acquired on your patient. And that's it. And also, you wash our hands in order to prevent ourselves from infection, and again prevent cross-contamination between our patient and us. Then that's it. That's for the Leopold's maneuver return demonstration. And again, I'm Angel Libres from 12C.